Well, good afternoon. I want to thank everybody for being here today. Governor, thank you. Chancellor, thank you. And the team, Craig, good to see you again. And Commissioner, good to see you again. No, I'm privileged to be at the UMass Chan Medical School with you here today. I also want to thank the Healey-Driscoll administration for being a frequent visitor to our city. While I know we have a long few years ahead of us, I believe that we will be able to get through all this by working together in partnership with our stakeholders at all levels of government. We're so privileged to have a fine institution like UMass Chan in our community with brilliant minds that are internationally recognized for their work and 2 Nobel Peace Prize winners. The research that is being housed in this campus holds the solutions for some of the humanity's greatest ailments. Unfortunately, cuts from the National Institutes of Health may set us back in our quest to find solutions to problems. I can take comfort in knowing that our state does not stunt growth, and we hope that we can find support to keep the valuable work going here. Massachusetts is known for being home to some of the finest institutions in the country, and I'm proud that our state is led by an administration that supports the work being done by people in this building and throughout the Commonwealth. It is now my pleasure to call on the champion for the Team Massachusetts, a supporter of Worcester, and the governor of our great state, Maura Healey.
Thank you. Thank you so much, Mayor. Thank you, Mayor Petty, and good afternoon, everyone. I want to thank Chancellor Collins and all at UMass Chan Medical School for hosting Commissioner Robbie Goldstein and myself today. Thank you for showing us this stunning new facility, the Paul J. DeMare Center for Education and Research. I'm honored to be joined by our terrific Commissioner for the Department of Public Health, Dr. Robbie Goldstein, as well as members of the legislature, including representatives from Senator Moore's office. I was here last May to speak at commencement, and I felt incredible enthusiasm across this whole community, and that was well-deserved. We were celebrating doctors, nurses, and scientists who were graduating, setting out to heal the sick and cure disease in our state, country, and beyond. This year, we've been celebrating our Nobel Prize winner, Victor Ambros, who was a UMass Chan scientist. I was just upstairs touring his lab. And he's not the school's first Nobel laureate major prize winner either. We also have from here Craig Mello, who won the Nobel Prize back in 2006 and continues on in science here at UMass Chan. UMass Chan is foundational to our state's success. It's an example of the incredible assets that we have in our state. It trains world-class doctors and nurses with nationally recognized leadership in the primary care space that's so critical to our health system. It supports access to care at more than 100 clinical affiliates statewide, from Cape Cod to the Berkshires. It also hosts an amazing VA program at this outpatients facility right here on campus that is serving nearly 20,000 veterans. And UMass Chan scientists are advancing knowledge and finding cures for diseases that help make Massachusetts the global capital for life sciences. And overall, it has a tremendous impact, positive impact on the economy in Greater Worcester, employing 6,000 people in good jobs and creating over $2 billion of total annual economic impact. And it's helped Worcester become the 15th largest life science cluster in the entire country, ahead of much larger cities. So, look, I'm here today to honor and celebrate UMass Chan. As I said, it's an incredibly important asset and institution, not just for our state, for our country. The way in which people are trained here, whether they're going into a hospital or a clinical setting, or the scientists and the researchers who are pioneering new cures and treatments for all sorts of diseases and issues, is truly amazing. The reason I am here today, though, is because institutions like UMass Chan are under threat. They're under threat from the Trump administration, which announced weeks ago cuts to funding for NIH, the National Institutes of Health. We need to make clear what's at stake here, because UMass Chan is such a great institution. It, in fact, wins more NIH funding than the total amounts going to 26 other states. Last year, it received $193 million. But this year already, Over $30 million in expected grant funding has been withheld or withdrawn. Another $50 million is at risk. The funding cuts are very extensive, including supporting critical work in gene therapy, rare disease research, HIV research, digital medicine, neuroscience, and more. UMass Chan has held groundbreaking clinical trials of new genetic therapies for devastating conditions like ALS and so many other diseases. But this kind of progress is now at risk, and with that, hope is being stripped away from patients and families. I just had an opportunity to sit with members of the faculty here, and here's what's happening. Here's what was some of what was shared with me. Already, UMass Chan, and I think this is a comment that I am making that is not specific only to UMass Chan. It is something that other research institutions, teaching hospitals, medical schools are experiencing right now across Massachusetts and across the country. And it's really, really bad. These are cuts to science, cuts to research, and cuts that will be irretrievable if something isn't done to reverse them. As a result of the cuts that have happened already by the Trump administration, UMass Chan has had to cut its class sizes, has had to actually rescind offers that were previously made to people who want to come and study here and do research and train as scientists, maybe the next cadre of Nobel-winning scientists out of this institution. They've had to pause faculty recruitment because this is a very uncertain time and they're not sure what can continue to be funded. Graduate students, postdocs, and junior faculty are looking at their careers and wondering what their future looks like and if it can continue to be in science, in research, in medicine. America is the world's leader in innovation, and Massachusetts has been the country's leader in innovation. And we have the receipts to show for it. Receipts that speak to a economy of an ecosystem that is born from research and science and nurtured through the work of our clinical programs and our teaching hospitals. We're talking about hundreds of thousands of jobs and millions, billions in economic impact. And maybe more important in what is sometimes hard to quantify in terms of a price is the way in which research and science coming out of institutions like Chan here in Massachusetts are changing and have changed people's lives, literally saved lives by curing diseases, by providing innovative treatments, changing the world and outcomes. But all of that is under risk. And it's the result of a terribly misguided and self-inflicted wound by the Trump administration. Because of these cuts, we now have other companies coming to Massachusetts and coming to other states looking to recruit our scientists and researchers. The Trump administration is essentially giving away intellectual assets to other countries right now who will find ways to bring these people on board, hire them, and then that research is going to be done over there, and those discoveries are going to be made over there. I think about all the life sciences. You know, Greater Boston and Massachusetts, we are home to 18 of the top 20 major life sciences pharmaceutical companies in the entire world. They come here for a reason, just like 100,000 foreign students come here for a reason. This is the place to learn, to do research, to innovate, to make new discoveries, to start companies, and to grow in life sciences. But too often, whether it's China or other companies, right now, they're the ones swooping in for Massachusetts American talent. It's also true that the budget proposal that the House Republicans recently passed and that President Trump called for would strip hundreds of billions of dollars from another source, Medicaid, in order to fund tax cuts for the wealthiest. So we have cuts to NIH happening alongside proposed cuts to Medicaid. That will jeopardize health care for over 2 million patients in Massachusetts alone, the proposed cuts to Medicaid. And that includes, of the 2 million people we're talking about hundreds of thousands of children, many of whom get their care at UMass Chan affiliates. In addition, we've already seen massive layoffs at the VA, which has put veterans' health care at risk. These cuts don't reflect Massachusetts values. They don't reflect American values. They're not who we are. Americans want to support innovation. We've been about that for a good long 250 years and counting. They want to support research. They want to support science. Americans want veterans to be helped. They want our children to get health care. They want the economy to grow and create jobs. And they want cures for diseases that hurt loved ones. That's what UMass Chan does every single day. That's what Massachusetts does. That's who we are and what we're about. And that's what we stand for. So today, we stand with the scientists, we stand with the researchers, we stand with the community at UMass Chan and the greater community across the state when we speak up against these cuts. And we'll continue to speak up about this. And I now want to bring forth a person who's been an incredible leader for UMass Chan, and that is its wonderful Chancellor, Michael Collins.
Thank you, Governor, very, very much for being here today. Thank you, Mayor. Commissioner Goldstein, always nice to have you on campus. Craig, thank you for your continued leadership here. I'll be brief because I know you probably have some questions for the Governor. Just make a few comments. Research brings hope to the human condition. We've worked hard over those 2 decades to build one of the finest academic research institutions in the world. When we recruit a faculty member, we see the top 5 people in the world, and we're able to recruit the person that we want to be here. And now that research infrastructure, the very essence of research funding, is being threatened. A colleague of mine said a few weeks ago that NIH funding was like the sun. It comes up every day. Research funding comes every year. And now, having built beautiful facilities, have attracted some of the finest scientists in the world, we have these very precipitous cuts. There's been all sorts of conversation about indirect costs and paying for facility fees. That is one element. I'm sure there's something that all of America's research enterprises could work out on that with relatively short amount of time with some great thinking. But what's happened in addition to that is that grants have been stopped from being funded. That study sections and councils, which is the process used by the NIH to award grants, has more or less ground to a halt. And that's costing serious resources for institutions that are trying to maintain incredible science at a very important time in its history. One other point. We attract some of the incredibly talented youngest minds in science to come to our institution, to be either a learner, a postdoc, or a junior faculty member. And these folks are particularly threatened at the moment. When you come to an institution, the institution provides research funding for the first few years, and then research support is garnered from either foundations or the NIH. These faculty, these future thought leaders, Craig's Nobel was almost, the science was almost 30 years ago. 31 years ago was when the science was. The prize was awarded 12 years later. The future Nobel laureates could be at risk if this funding does not come. And I'm proud to stand with our governor, with our Commissioner of Public Health, with our Attorney General, folks who understand this issue and have been at the forefront of arguing for it. I think it's time to put partisan politics aside, to understand the importance of America's research enterprise, to get the funding back flowing, and then let all of us come together to work through whatever issues we need to work through so we can assure that America's Biomedical Research Institute remains the finest in the world.
Thank you, Chancellor.
Thank you, Governor.
I'm calling an audible. Craig Mello, why don't you come up, Craig, and just offer your thoughts on all of this as somebody who's benefited from NIH funding. You understand. And as a scientist and a researcher, and not for nothing, a Nobel laureate out of Massachusetts, can help explain to folks why what the Trump administration is doing is so devastating.
Thanks, Governor. Yeah, my heart breaks every day for the patients and the families who could benefit from the work that's going on here and elsewhere inside of academia. We have at our fingertips now really transformational medicines that are based on genetics. We've done a really bad job of explaining what that means, but if you're the patient getting one of these therapies, believe me, you come to understand it. My own daughter developed type 1 diabetes at the age of just 1.5, and I knew nothing about that disease except I knew about the gene and I knew about the signaling pathway, but I didn't know what it was like to be a patient with type 1 diabetes, which used to be a death sentence. Every single child who developed juvenile diabetes until about the end of the 1920s died inevitably, a horrible wasting death. It was worse than cancer. The prospects were horribly grim for these kids. And now there's a drug that came from, scientists just following their curiosity, working to try to discover what was missing from these kids that were dying. And that's what we've been doing now for decades. And it's just heartbreaking now with the genetic understanding of disease. We now know what's missing in so many different patients. We now have the ability with gene therapy and with this siRNA technology, pardon the jargon, we can actually fix it in many, many cases. And that research is funded by mostly the NIH, other funders as well. We're so grateful for philanthropic funding. We could certainly use a lot more of that. The state has backed us, throughout this whole process. And the beneficiaries of this are the patients. And right now, they are the ones who are going to be suffering the most. And it may be someone you love. It may even be you who could benefit from these therapies because they are going to impact everyone in the coming years. As you know, we understand the entire genetic code of the human now. Just think about that. We need to get to work to make the drugs that can help our fellow humans. Sorry, that's the indication I've gone too long. I think I should stop there, but yeah, thank you, and thank you, Governor,
Thanks,
for
Craig.
coming.
I appreciate it. Thank you very much, everyone.
Your attention, please.
Give it a minute.
The signal tone you have just heard indicates the report of an emergency in this building. Floors 7, 8, and 9. Walk to the nearest exit or exit stairwell and exit the building. All other occupants
Okay.
may remain on your floor until further instructions are
We'll just wait a minute? Okay.
Attention, your attention, please. The signal tone you have just heard indicates the report of an emergency in this building. Floors 7, 8, and 9. Walk to the nearest exit or exit stairwell and exit the building. All other occupants may remain on your floor until further instructions are announced. Attention, your attention, please. The signal tone you have just heard indicates the report of an emergency in this building. Floors 7, 8, and 9. Walk to the nearest exit or exit stairwell and exit the building. All other